So, a bit nervous being up here and seeing everybody. But my name's Nicola. I work in marketing for Nutricia. And so Nutricia...
Green button, sorry.
There we go.
And if you want to go backwards, red button.
There we go. So who are Nutricia? So Nutricia are the leading UK medical nutrition and feed service provider. And we also have a service called Nutricia Homeward that provides support for our tube feeding patients at home. So anybody who's feeding with a nasogastric tube or a gastrostomy tube. And we have about 30,000 patients across the UK that we look after. And we have 160 nurses across the UK who provide that clinical support for those patients as well. So I'm here to talk to you about podcasts, which feels a bit random when you're talking about medical nutrition and tube feeding. But I think it was the process and why we started to think about podcasts that really kind of, I guess, inspired us to put forward a submission from a patient experience perspective. So this was an idea that came from one of our Homeward nurses, who's actually sat in the audience now listening to me. So it came from a conversation that he had had with one of his patients who really wanted to find out more information. So if you can imagine, when you're starting to tube feed, you're given lots and lots of clinical information, lots of practical information about, keeping your tube clean, flushing with water, how to use your feeding pump. And for a lot of people, this is coinciding with a life-changing event. So they might have been diagnosed with cancer, they might have been discharged out of hospital, having had a stroke. So it's in combination with a lot of other things that are going on in somebody's life. And often people have never met somebody else who's tube feeding before. So those feelings of isolation are really, really high and really, really strong. And if you think of how important food and drink is in our everyday life. Most people at the coffee break had a coffee, a glass of water, something to eat. Everybody's kind of getting ready and now looking forward to a little bit of lunch. Probably looking forward to the weekend when you're going to meet up with some friends, have a drink, go out for a meal, have a coffee and a cake. To suddenly find that that aspect of your world has changed can be really, really daunting for a lot of patients. So that whole trying to make sure that people don't feel isolated, that they do feel supported and that they're not alone is something that is really, really key in terms of what we do at Nutricia and what our Homeward nurses actually do as well. So to give a little bit of background about podcasts, when the idea was first mentioned, we started to do some background research. And so we found just a little bit of desktop research that 71% of the UK population listen to podcasts. So show of hands, who listens to podcasts in the audience? Very reflective of the research that we ran. And that we can see there that UK podcasts have a weekly reach of about 19%, peaking in that sort of younger adult age group. And bearing in mind that 40% of our population, of our Homeward population, are under the age of 18, and so therefore cared for by somebody who is probably within that age group, we thought that this was quite a good opportunity and quite a good idea to explore further. And we also found that there was no current UK podcast for tube feeding patients. There were podcasts for healthcare professionals about tube feeding, but nothing designed specifically for patients. So we moved to our next phase, which was patient research. So we ran a questionnaire. It was a small questionnaire, very, very simple, 5 or 6 questions with 26 new patients. And over a third of them currently listen to podcasts, so that was very reflective of the audience here. Over half of them said that they'd be interested in listening to a podcast in the future about tube feeding. And nearly 70% said, if they're rating that idea of a podcast around tube feeding as 8 out of 10 or higher in terms of they were very interested in finding out more. So the next phase was some qualitative research with patients. So we did 6 patient interviews, really to get some ideas of the type of topics that people wanted to know more about. And the things that came out really, really strongly was to hear from others who are tube feeding, some practical top tips on what to do when you're tube feeding and you're not sat at home. So you're at work, at school, on holiday. So it was a very practical element that people wanted to know about. So we then went into the planning phase. And when we drafted up our plan, we actually shared it with one of our very experienced tube feeding patients and his wife to give us a critique on it as well. And that was really, really useful. So we then went into the recording of the podcasts, and we launched the first 4 podcasts in March this year and 3 more in August. And you can see that so far the data was run at the end of September, and you can see that we've had nearly 1,000 listens, which is really brilliant. You can see the top 2 are starting to tube feed from a parent's perspective, and our very first episode, which is What is Tube Feeding? So all of our podcasts have been recorded with our host, who is a dietitian, a home enteral feeding dietitian in Sheffield. And we have both healthcare professionals on our podcast, but mainly patients. So what we've found that works really well is where we have 2 or more guests on the podcast, and they then have a conversation. We record the podcasts over Zoom, so we don't have to get people into a location. There's no fancy technology. And we also don't edit out the ums and the ahs and the coughs. So it feels like it's a really natural conversation. It feels really, hopefully, as if people are just listening to somebody chatting about it. So that's what's worked really well. And we have had some feedback, both from healthcare professionals and patients. And I think sort of one of the ones that really stands out for me is where you've got an adult tube feeding patient saying that they've been tube feeding for a number of years, but didn't realise that young children also were tube feeding. And then also the one that's just on the far right, and that was from a parent who said it's great to hear about an independent teenager managing tube feeding. So one of our guests on our podcast is Olivia, who's 18 years old and at university and has been tube fed since she was a child. So it's reaching that whole span of different people. So in summary, it's really, we thought was quite a simple idea, but obviously a little bit out of our band of experience in terms of podcasts. So we did do quite a lot of background research in terms of is this going to be a good return on investment in terms of time. But patient insights and having that co-creation all the way through was really, really crucial to make sure that we've got the right topics that would engage people. Podcasts are popular, they're accessible, and it's a great way of communicating in quite a natural format with our patient population. And patients really want to hear from others that are in a similar position, and they don't want to feel isolated. They want to feel there are others that they can learn from that are going through the same situation that they are. Thank you very much.